Hi, I wanted to go over this thing about transgender again. I've been seeing more things that come out. I watched a video with Senator Hotley and a professor, can't remember her name, I think Brown, and there's been a bunch of laws that came out, and I was trying to have a better understanding of what's going on versus all of the anger and hate from all of the people who are out there. And I was looking at it from my perspective, because again, from my perspective, when I look at those things, I see uh, it from the perspective of the DSM, okay, the Diagnostic and Statistical Manual for Mental Health. They're claiming to have a mental health issue. They're claiming that this mental health issue is doing these things. And I've repeatedly mentioned the suicide rate. My daughter has been suicidal. I've had to have her committed for these things. And so one of the laws was that you can't transition, or you have to detransition when you're under a certain age and so forth. And when you look at the issue, and I've brought this up before, you look at the DSM. The DSM has two conditions for people who do cross-dressing, basically. And I've used the analogy of pot as a medication, and you have people who use it for medical purposes, but then you have the recreational users, and that's a very good analogy here. It doesn't, it's not one-to-one perfect match, but it's pretty close, and it's close enough to understand that when you have transvestitism, which is in the book, transvestitism is when people like to be in the opposite sex clothes. They cross-dress. And they like to do it. They like to do it for a number of reasons. You have all of the RuPauls and the drag shows, and some people like to do it because it's kinky for them, or it's sexually a turn on, and it does these things. I don't care what the reason is. And when they talk about how they are oppressed, and how this condition, if you would, because it's not all conditions are like medically whatever. I mean, it could just be like you're a jerk or you're a whatever, and that's what that condition is. It's being a narcissistic doesn't mean we lock you away. It's not like it's this. It just means that you've got a crappy attitude, kind of, or a specific kind of crappy attitude. Um, so that's kind of like what transvestitism is. It's not, it's just an attitude that most people don't connect with, and do. You know, the vast majority of America, they want to sit there and say, 1% of the population, 2% of the population, that would be 60 million people. Okay, that's a lot of people, but it's still just a small percentage of the population have that little thing. Well, that's fine, and they can have that. Um, and they can do cross-dressing recreationally to satisfy whatever those things are. But for somebody who has gender dysphoria, okay, you have an individual who is obsessed with the conflict, and I keep doing this, it's a conflict between what their brain says they should be and the reality of what they are. That's where their conflict happens from, okay? Not anywhere else. This is where the conflict is. They don't care what anybody else sees. They don't care what anybody else thinks. They don't care about pronouns. They don't think they are the opposite sex. They know it, that they're not. And that conflict is what causes them problems. And I've mentioned the suicide rate on these things. And so, again, to be transgender, okay, to go through transgender therapy, you are diagnosed with gender dysphoria, and then you are prescribed this treatment, and you go through whatever, because it's a pain reliever. It's like, okay, it's the last ditch. There's no healing this person anymore. There might be a way to heal them when they're younger, but we don't know because people aren't exploring it. And but we just say that they can't be cured. It's like autism. They're just born and that's it. You can't, I don't think that's true. I don't think that's true. But if in fact it is, we prescribe transgender. And so cross-dressing and all of the other stuff that goes on with it, and how far you take it, um, is a treatment. It is a treatment to say, let's get you just as close as we can. You can't actually be male. You can't actually be female. But we can make it appear that way, and we can do everything, even cosmetic surgeries and everything, to make you as close as possible to what you think you should be, in order to keep you from committing suicide. I've said that a million times. We do this treatment to stop their suicides. But the suicide rate, according to all of these people, is going up. They're saying that now, there was a study that 82% have thought of killing themselves and 40% have tried to kill themselves. And suicide rates are going up. Okay, well, maybe the reason that people are rejecting the therapy and saying you shouldn't do this is because the therapy is causing the suicide rate. Maybe it's because these people are not accepting of what they actually are that causes the suicides. Now, I'm going to tell you that the suicide rate is not because of being ignored. It's not because they're being this and that and the other. I've seen it firsthand. I've talked with so many other people in transgender stuff, like my daughter. That's not the reason. They've never said, I want to kill myself because of this. She's gone in because she's tried. She's gone in because she's got those thoughts, and she's like, I'm going to do it, Dad, and take her into the hospital. And she's like, that's never the reason. Every one of the others, that's never the reason. I'm bullied. They don't use my pronouns. They don't do this, that, the other. Never from what the outside imposes as far as they don't think that you're whatever. It's because they know that they're not that, and they can't be that, and that it's not a reality. It is that a clash. That clash is what's causing the suicide attempts. But if you're trying to tell everybody that, the suicide rate is going up, then they're going to look at it and they're going to say, you know what, the treatment's not working. It's having a backwards effect. It's having a bad effect. The cure is worse than the disease. That's what you're telling them. Okay? So all these advocacy groups sitting there talking about suicide and saying that the other is the reason, well, then maybe that's not a good treatment. So my personal view is I don't think that's the reason. I don't think that's the reason. I think the reason is that you have transvestites and gender dysphorics, and that they are completely different people. And I think that the transvestites' suicide rate has now been imposed into the transgender community. And when you do this sort of thing, I think it's, and since it's been such a very popular thing to be doing this, transvestite thing, because that's what people do, is they're doing transvestite. They're not doing gender dysphoria. Okay? They don't demonstrate the symptoms of this. They demonstrate the symptoms of this. But it's like they're all coming out of the woodwork and joining in, and it's the popular thing to do. It's the new popular. And so they're doing this, and I don't think it's bad for the transgenders. It's a medication. But it might be bad for the others. If they don't have a healthy mechanism on who they are as a person or any number of things, They need to separate the two and deal with this as separate issues. And doctors need to be a lot more careful when they sit there and talk about, transgenders. And maybe there needs to be more regulations on doctors, and we need to start talking to some of these doctors who are trying to diagnose people as gender dysphoric, because it's not one of the symptoms. It's not one of the if they're not having the symptoms over here, but they're having all of these, then why are you diagnosing them with the other one? Is that going on? And then you're doing these surgeries, or are they doing back alley surgeries? Are they doing something that's harming themselves? That's more likely something to consider. To be honest, I really think that we need to start having better conversations about, okay, that is transvestite, this is transgender. They're all about separating everybody into groups. Let's do it. Separate transgender, transvestite. Transgender is a treatment for gender dysphorics. You have gender dysphoric, you have transvestite. You're using it recreationally, they're using it medicinally. You're using it for different reasons, different purposes. You've got to look at those factors. So I really, really would like to see people start properly grouping these people and stop sitting there and trying to do, stop allowing them to just crush over.